Hi again. This is Dr. Kathleen Young, board certified child, adolescent, and adult psychiatrist. And I want to talk to you in this video about special interests in autism spectrum disorder. And I say and in neurodivergence because I think there are traits and features of autism spectrum disorder in people who are neurodivergent and may not have the full picture of ASD. And so when we think about special interests, it's really intense or special interests. So sometimes the interests are unusual, like knowing the information about the elevators in the building or train schedules or things like that. Those are sort of the stereotypical ones we think about in people on the spectrum. And then sometimes they're just special, like intense interests. So they don't have to be unusual. It could be an intense interest in like Taylor Swift or a particular artist or a particular topic or a sport where that's all they do. And I think it's important to really understand that the intensity of it is beyond what you would expect. It doesn't have to be that it's unusual. And so when we're thinking about special interest, you don't want to dismiss things that seem more normative, right? More neurotypical as not being a special interest. And I think the other thing I've noticed is that that's kind of the way the autistic brain works, right? People get very tunnel visioned and very, very, very intensely interested in one thing at a time. And these interests can shift over time. It doesn't have to be the same interest their whole life, but it could be, for a period of time, they're really interested in this or this or this. And I think that's just kind of how the autistic brain works. And so as a parent, because I often work with parents, it's important to understand that when you're asking your kid to engage less in something that they're really interested in, you have to keep that in mind and problem solve around the fact that like this is what they're really interested in. And if you ask them to stop doing it, they're not going to know what to do. So it's really about problem solving ahead of time and helping them find something else to do, um, or or like temporarily finding something else to do, or maybe finding some way that you can, what's the word I'm looking for? I can't remember because my brain is like that sometimes, but how you can parlay that interest into something else. So if you want them to get a job and they're really, really interested in the health industry, then how can they use that to find employment? I hope this helps, but again, it's really remembering that like somebody's not going to just stop. And I heard a story about a person who had an injury, and because their special interest was working out and going to the gym, they just kept going even though their injury wasn't healing. And so the dilemma was like, well, what do we do with this, and it's not so easy to just tell your kid to stop. There's probably a lot of benefits that they get from working out. And so keeping that in mind as you're problem solving how to address this is going to really go a long way. It's not a matter of just being like, don't do it, or they should just know not to do it. It's understanding that this thing that you're asking them to stop doing temporarily is something they really want to be doing all the time. And if they're not doing it, what will they be doing instead? And problem solving for that. Hope this helps. And as always, leave some comments if you have any questions or any other topics you want me to cover.